Salam viewers, this is your host Muhammad Ali Haider and you're watching your very own career quest where dreams meet direction. They say not all heroes wear caps. Some wear white coats and carry stethoscopes. But what does it take to don this white coat? Is it just about the years of study or is it something far bigger, far greater than that? Today, we'll delve into the world of doctors. We'll know what it takes to become a doctor and what really is becoming doctor all about. We have with us today a senior medical expert, Mr. Professor Dr. Atif Mehmood. Assalamu alaikum, sir, and I welcome you to the show.
Thank you.
Before we formally begin our discussion, let's give a look to this report.
Healthcare is more than just doctors and hospitals. It's a world of dynamic, fulfilling careers that go far beyond traditional medicine. Today, fields like medical imaging, physiotherapy, biotechnology, health informatics, and public health are gaining momentum in Pakistan and across the globe. Today, fields like medical imaging, physiotherapy, biotechnology, health informatics, and public health are gaining momentum in Pakistan and across the globe. These careers offer meaningful impact, professional growth, and the chance to serve communities in powerful ways. Universities in Pakistan are now offering specialized degrees and diplomas in these areas, making them more accessible than ever. As the healthcare landscape evolves, so do the opportunities. If you are passionate about helping others and exploring innovation, a career in healthcare beyond medicine could be your calling. The future is bright and the possibilities are endless.
Welcome back from the report. To formally begin our discussion, sir, first of all, I'd like to know that what does it take for a student to get an admission in a medical college?
It takes a lot of determination and planning.
Okay.
And it takes a lot of understanding of what they are going to go ahead in their life. It's not just a very hard study. They get used to and they're trained to a hard-working career in life. So it starts, the journey starts from their FSC or the A-levels when they decide to take the pre-medical subjects like biology and physics and biochemistry. And then they go through the tough 2-3 years of studies, pass their exams. And they have to not just pass, they have to get very good marks, high level of marks, because they're entering into a very competitive field. Then after taking good marks, then they sit in the MCAT, which is examination conducted by the Pakistan Medical Dental Council all over the country, so that there is a standard, no different, so that all the medical colleges, they have a same standard of exams.
Okay.
And then after passing those, and you just can't pass. You have to
score well as
well. And then combine, they get admission, they get the numbers. Now, how tough it is that the medical college with the admission just completed, the top med school percentage was 91%.
Oh, that's huge.
And the last was 82%. So in Punjab, among 40-50 med schools, the all admission finished in 10%.
Okay.
So, and the first 3 med school, they were percentage was between 89 and 92%.
All right.
So 3 med school admission finished in 3% of marks.
Very hard competition.
It's very hard. So, and it takes, from the time they go into the FSC and the A-levels to the time they get admitted to the medical college, it's a 4 years of hard work without any break. The moment they pass their FSCs and A-levels, they start studying for the MCATs. And once they enter into the med school, they find a big relief. But that relief lasts a very short period of time.
Okay.
The moment they enter into the med school, they realize that their study and the hard work has just started again.
Oh, all right.
And that thing goes on because there is this continues for 5 years. At the end of every 1 year, there's an exam, and the subjects are huge. I mean, medicine keeps on changing. New avenues keep on coming, new diseases keeps on coming, and the technological development in the medical profession is huge. And so the students, they hardly get a relief in between the med.
So you talked about students. I completely agree with you, but I'd like to know that, career counseling is a huge challenge right now faced by the youth. What sort of students you think should pursue medical?
That is very important because a very large proportion, I don't have the exact figures, but in my med school, average 40 to 50% of the students, they are not able to pursue their postgraduate studies.
All right.
And just doing MBBS
It's not enough.
is not enough. There's no such thing as MBBS, simple MD anymore anywhere in the world. Everybody has to go into some speciality.
All right.
So that is a huge loss to the nation and the resources. And why a large proportion of the doctors are not able to pursue their careers, or they, if you look at the bureaucrats, if you look at the police force in the civil service,
We see a lot of doctors
you
there.
see a lot of doctors, right? And having gone through that journey of such a hard study, and then just leaving it, you could have just done a bachelor's and done a CSS examination. Why do you need to go through 5 years of extreme hard work? So that is very, very important at the level of the schools. And it's very important that the students, before they decide to go to a med school, decide to go to the doctors, become doctors, they should visit doctors. They should
Very
visit
important.
the medical colleges. They should meet the doctors. They should see what the life is like that.
And what their journey has been.
Yes, because the journey of the doctor doesn't stop. That's the thing, You do MBBS, then you do post-graduation. Depending upon what post-graduation you are going to take, that may take up to 5-6 years.
That's a hell lot of time.
So basically, by the time I did my MBBS, then I went to England to specialize. So it took me another 7 years to specialize, to become.
So it's a journey of more than a decade then.
Yes. So by the time you have finished yourself, that means you have done your specialization, you are 28, 29, 30. So basically, if you look at it, you have been from the time of the FSC or the A levels to the time you have become a postgraduate doctor. It's a journey of 12, 13 years.
Very true.
So the students should go and visit. And the high school should have a career
Counselor.
advisors,
Yes.
counselors. And because they have been seeing those students in the A levels. So they know what the students are like. So it's very, very important because becoming a police officer, there's no harm becoming a police officer, but becoming a police officer through doing a med college is a huge wastage of resources. Because
And you don't justify with your field.
no. But so basically, when you are doing a government sector medical college, the nation is paying on the average 20 lakh rupees per month from their pocket. They are not charging you. The government did not charge me. They charged me 1,000 rupees. The rest the government paid from their own
That's
pocket.
true.
So that is a loss to the nation, because that nation spent about 50 lakhs on you, and you left that and you gone into some other field which is a non-medical.
Sir, absolutely right. But sir, I'd like to know that there are certain global medical trends and then there is a certain path that is being followed here in Pakistan with regards to the industry of medicine as well as medical colleges. So what difference do you feel, and how can we overcome this difference?
You see, we have to look for the future, and we need to see where the future is going. The future is going towards minimum stay in the hospitals, minimum invasive procedures.
Okay.
Because to cut the cost and to cut the minimum loss to the patient's sufferings.
All right.
That's how, for example, the laparoscopic surgery, right? A few years back, when you used to remove the gallbladder with the open surgery, the patient used to stay in the hospital for 5-6 days. They needed a care for a couple of weeks. But now with the laparoscopic surgery, you go home in the evening. So that basically cuts the cost tremendously, cuts the suffering of the patients a lot, and reduces the size of the hospitals. Everywhere in the world, they are shrinking the sizes of the hospitals. So basically we need to invest into technology. We need to invest more in the laparoscopic surgeries. We need to invest into the robotic surgeries. They seem initially costly, but eventually they are not costly. So when you do that, you reduce the cost.
True.
And you improve, you leave the cost, but you basically improve the quality of the care you provide to the patients.
Very
so
true.
we need to invest into that. We need to invest less in the buildings. We have huge buildings.
True.
So we need to invest into MRIs and CT scans, like a lot of neurosurgical procedures, which used to be open neurosurgically. Now, everywhere in the world, radiologists are doing those. So, for example, this carotid artery used to get blocked, and 8-9 hours surgery used to be performed. Now, this thing is done non-surgically, non-invasively in 1-2 hours. So that's a tremendous difference, and we are lacking a lot in this. We need to, and that is one of the reasons our postgraduates, when they are now going abroad, say in the Middle East, they are finding a difficulty to get the jobs because, in the global market.
They are losing the relevance.
They're losing the relevance because they are not trained as compared to the competitors who come to the Middle East. So, for example, if there is a radiologist from our neighbor, he will be much, much more technically trained than a radiologist who's going from Pakistan, with the exception of few institutions.
You're absolutely right, sir. And talking about technology specifically, I'd want to know that how is artificial intelligence and other technological advancements impacting the field of medical?
There's a tremendous difference now. Recently, I was abroad on a training course, and I was looking at the bronchoscope, the machine which we use to look at the organs and the tumors inside the lung. It's like endoscope which goes to the stomach. This goes to in the lungs. So when I went to the setup, they had a computerized section in which the bronch had a filament. It had a probe, and the CT scan was gone into the machine.
All right.
So that scope was being guided by the computer towards the tumor. So that basically means that the chances of me missing that tumor was minimized.
Yep.
So that was a great technological improvement. Otherwise, over here, we struggle. We go into the lungs, we are not able to reach the tumor, we come out, we go back again. And sometimes we'll say to the patients, we can't reach to you, right? We'll have to operate.
So the chance of human error is reducing.
Oh, yes. Because in the West, the technology was propelled by two things. Number one, to reduce the cost and to improve the efficacy. because if you make a mistake there, if you are doing this, insurance, they will ask you, you charge $20,000 and you have in the report written could not reach the tumor or normal, which the CT scan shows there's a tumor. So you are saying I couldn't reach the tumor and you charged us $20,000. So, and in the Pakistan scenario, if you look at it, we have a huge population. We are one of the top 5-6 populous country in the world.
Very true.
So that basically means if we go technologically advanced, now the load, now if we in England, if we in a session, we used to do say 10 scopes a day. Over here there's 60, 70 because Pakistan population, if you take even the population of Lahore, it's huge.
Very true.
So if you have those facilities, you will be able to do 100 bombs a day.
Very true. So talking about specializations, as we have already talked about the technological advancements, are there any sort of emerging specializations as well that our youth who are pursuing medical must look forward to?
There's a scope in every subspecialty. If you look into the society, there are cardiologists who are doing so well, there are pulmonologists who are doing so well, there are dermatologists who are doing so well. So, and a human being is Allah Ta'ala has made an amazing thing. And it's become a subspecialty field that, now in the West, an eye specialization is 7 years. So you would think, what in the earth are they doing for 7 years, right? A small eye.
It's a very small
eye.
Yes.
But now in England, the specialization of eye to become a consultant ophthalmologist, it's a 7 years program. So it's all so much developed that there is a tremendous scope. So we advise our students that every subspecialty, if you excel, you will do very well.
Absolutely right.
So there is no, I always advise my students whenever they come, I always say, do what you like to do it passionately, and you will excel.
So talking about finances, ultimately everybody studies to get a job and earn a living. How much of the medical field in Pakistan is lacking with this regard? And what students must do to ensure, a good earning to start, a living?
They have to do just one thing. They have to become a good, competent doctors.
Okay.
Now, if you look into the private practice scenarios in Lahore, you'll find certain doctors who are so busy that they leave their clinics 1 o'clock. They see 50, 70, 80 patients a day.
True.
There are other doctors who see 5, 6 patients a day, and they're not doing financially good.
Yes.
So there's only one path to gain financially. That is to become a competent doctor.
True.
Because at the end of the day, when a patient comes to you, he wants to get better with your treatment.
Absolutely.
He gets better, he will come back again, and he will tell 3 other patients, other people,
there is a good doctor here.
that I went to that doctor and I got better, go to him.
So your point is noted. With that, I'd like to take your concluding remarks as we are closing.
I would say that having said all that, medical profession is one of the oldest professions in the world.
Very true.
And one of the most respected professions in the world.
Indeed.
To this day, people call Dr. Saab. And it's not in Pakistan, it's worldwide.
And it's taken as a pride.
It's worldwide, and it's one of the few professions in the world in which you make money and get respect as well.
True.
And people are grateful and they show you gratitude. So it's very important that when you enter into this profession, you should enter into this profession with this, that, I'm entering into a very honorable and respectful profession, which will give me finances as well as respect at the same time.
I totally agree, sir. Thank you so much for being with us today. It was a pleasure talking to you. With that, we conclude our show. As we have learned today that being a doctor, it's an honorable work and an honorable field. So it's on us how we carry the field of doctors and how do we work in this field. Beyond prescribing medicines and years of education, there is a lot to know, to learn and to achieve. This is your host Muhammad Ali Haider signing off. Till next time, Allah Hafiz.